Hello, everybody, and welcome to another episode of Millennium Live. I'm very excited to be joined by one of our really cool solution providers. Today, we have Mercury Healthcare. Mercury Healthcare is a data and technology-enabled engagement company, and they are out there for better patient engagement, which drives better outcomes. And we're going to be talking all about that today with Manish Goel. He's the Chief Technology Officer at Mercury Healthcare. A little bit about Manish. Prior to joining Mercury, he served as Global Head Technology Solutions for Envision Pharma Group, where he oversaw the development and support of the entire Envision solution portfolio. And previously, Manish oversaw the development and implementation of various technology offerings at companies, including IQVIA and Oracle. Manish received his PGDM from the Indian Institute of Management in Lucknow, India, and his BE of Mechanical Engineering from VJTI in Mumbai. Manish, thank you very much for joining Millennium Live today. Very happy to have you here.
Yeah, it's great to be here. Thank you for having me.
So today we're going to be talking all about using technology to create frictionless healthcare consumer experiences, which, as we know, better patient engagement drives better outcomes. So I want to jump right into it and get your perspective, Manish. As CTO, where are hospitals lagging when it relates to the overall healthcare consumer experience? Let's start with that.
Yeah, it's no secret that consumers now have a different expectation in terms of the level of experience they have in their interactions with the healthcare providers. It's very different from what they had in the past. And obviously, the pandemic has accelerated this change. So there's essentially an expectation of personalized service, simplicity and transparency in their interactions, with the assurance that the data that they're sharing will be kept safe and secure. Now, when you compare with other industries like retail and banking, healthcare has lagged behind in delivering a rich consumer-grade user experience to their customers. In a recent study on healthcare consumer digital experience by Centric Digital and Navigant, they analyzed the digital presence of more than 1,400 hospitals and healthcare organizations. And it's interesting to note that 9 out of 10 were found to be significantly lagging behind what we would call as healthcare disruptors. There are 3 key challenge areas that were identified in the study. The first was findability. Most organizations included in the analysis actually scored pretty low in this category due to lack of adoption of digital best practices to improve search engine rankings, as well as efforts to increase their online traffic. The second was content quality. The average healthcare provider lacked what we would call as mindful planning of online content. Basically, the third piece around that related to content quality is content navigation. The analysis also found that majority of the hospital and health systems website were very difficult to navigate and would not really enable visitors to easily and intuitively access the digital tools and content they had on those websites.
Interesting. So, keeping in mind what you mentioned, findability, content quality, and navigation usability, how can healthcare organizations make engaging with their services easier? How can, on an overall perspective, consumers interact with healthcare organizations in new ways in order to stay relevant?
Yeah, I think that's a great question. In order for a healthcare organization to better serve the needs of their consumers, they first need to better understand them. And they can do that by connecting data, not only the patient encounters, but also preferences and the social circumstances that are shaping everyday health and healthcare related decisions. They need to start using that information to then provide a more seamless and customized experience that treats each encounter as a step in a journey as opposed to a single transaction. I think leveraging AI is critical to analyzing these large data sets and extracting meaningful insights to drive an improved customer experience. A recent KPMG study found that almost 89% of healthcare executives that are implementing AI into their administrative processes did find efficiency and basically were able to improve their access to care. In addition to that, when you look at also a recent Optum's Insights survey, 85% of the healthcare leaders say that they have an AI strategy with 48%, having started implementation of some elements of that strategy. So this is a focus area for healthcare organizations, whether they actually have a strategy or are in the process of planning one. But it's a little bit interesting to see how their approach is different from what we've seen in other industries, right? In healthcare, the organizations are more dependent on partnering with healthcare services companies with basically expertise in data and analytics versus leveraging a technology company that's focused on solving a very specific, AI use cases. So to me, that's the first step in terms of, enabling customers to better interact with the services and capabilities available from a healthcare organization.
So we're talking about strategy now, and I want to know what trends you're seeing as, these legacy healthcare providers continue to vie for the consumer attention. What are they doing, and what trends are you seeing and what are they trying out? Let's put it that way.
Yeah. So again, before we get into that, I think it's important to really understand the market forces that are disrupting the current business models of healthcare organizations. You see ongoing mergers and acquisitions, including active vertical consolidation. There's an increasing impact of technology and continued, strong investment through private equities that is completely upending the landscape. So healthcare organizations are finding themselves, really adjusting to the customer base, instead of it being a patient, base that they were used to before. They're now dealing with consumers who are increasingly seeking care outside of the four walls of the hospital, more into outpatient, retail, and even home settings. So given these, market trends and market forces, healthcare leaders are at a crucial turning point when they're confronting a shared set of obstacles, right? How do they enhance their brand? How do they grow their revenue? How do they deliver what consumers want? And they can only do this by embracing technology, not only on the clinical side, but even on the marketing and other areas of operation to basically provide their services more effectively to their customer base.
That's great. That's really great. So I want to talk even more about technology. How are healthcare organizations using technology to develop these strategies for growth and of course, revenue generation?
It is really well accepted that winning customer loyalty is essential for growth, and engaged patients yield a higher return on investment as well as a higher patient lifetime value. Now, in order to drive patient engagement, I believe healthcare companies need to identify and implement technologies that can, one, integrate the patient and consumer information from a variety of sources, building, launching, optimizing, and measuring the multi-channel marketing campaigns, which is typically the domain of a customer relationship management type of a capability. They need to then streamline and classify content, as well as establish a framework to ensure that future content creation falls within the brand guidelines, which is typically the domain of a content management system. Facilitate the creation of personalized messaging and automated engagement efforts based on real-time data and triggers, again, typically the domain of marketing automation, and then help create an integrated omni-channel campaign by incorporating analytics, strategy and creativity. Again, this becomes more of a services strategy overlay on top of the three, set of capabilities that I talked before.
Yeah, it's great. So you mentioned loyalty, which is obviously a very important topic now in healthcare. If somebody doesn't have a good experience, they're likely not to return to that organization. So, and of course, you're mentioning technology. So let's put all that together in the pursuit of loyalty. How can healthcare organizations utilize technology to create what they consumers want, which is a seamless experience, which is quick and effective. And perhaps, what are some of the solutions that Mercury Healthcare offers in that?
Sure. So to help patients along their healthcare journey, healthcare organizations must re-examine their services and practices from a customer's perspective and essentially work to eliminate barriers wherever and whenever patients connect with them. So we at Mercury Healthcare offer a broad set of data-driven technology solutions that creates that 360-degree view of the consumers and patients that helps the healthcare organizations better engage with those patients and essentially improve the overall outcomes.
That's very interesting. And I want to switch gears a little bit and jump maybe to the future. And I want to know your thoughts, Manish, about like what's next for technology and perhaps the future of healthcare overall.
Yeah, I mean, I'm sure you'll agree that the coronavirus pandemic has fundamentally changed the way we live, work, and some of these changes will continue, through our future.
Of course.
And there is no industry as radically impacted by the pandemic as is healthcare, right? So the healthcare industry that we know today is not the same that we had 2 years back.
Right.
So essentially, healthcare organizations have to adapt and learn from the consumer experience innovation that has happened in other industries like retail and financial services, and essentially work to create a seamless digital experience where the patient's wants and needs are at the forefront. So given that background, I see a big push to develop and deploy technologies that, one, improve patient care and experiences, two, enable real-time information exchange, three, drive flexibility for both patients and clinicians using things like telemedicine, wearable healthcare, and then lastly, use of AI for not only for clinical decision support, but also for uncovering useful insights from the large collections of data typically housed in silos within various health organizations.
Very interesting. And so you mentioned a lot of technology. In your opinion, Manish, what is the most promising of these technologies in healthcare that may have some of the biggest impacts on the future of health?
Yeah, I believe healthcare organizations are sitting on an untapped resource. Most health organizations have accumulated a huge volume of both structured and unstructured data that basically they're really not using it to essentially drive better outcomes for their patients. Now, if we could basically look at that data and start to synthesize, a better understanding of the customer, which typically would not be possible without leveraging some form of AI-enabled tools that can sift through these large, complex data sets, that include electronic records, notes, images, sensors, devices, your response to marketing campaigns, etc. Healthcare companies will essentially use that to improve patient care, help researchers develop better treatments, and overall, improve the patient experience. So while AI technology is still relatively new, especially in healthcare, there are definitely many use cases that can benefit organizations, not only in a clinical space, but definitely in terms of improving the overall experience a consumer has interacting with the healthcare organization's services.
Right. And that's awesome. And I can't end the interview until I know what's happening with Mercury Healthcare and what's next. When we've been talking all about strategy and analytics and engagement data. So what's next on the Mercury Healthcare horizon? What can we expect to see?
Yeah, as you know, we provide a broad range of capabilities for the healthcare market today, including customer relationship management, marketing automation, and content management. A key differentiator that we have behind these capabilities is our data, the integration pipelines, analytics, and most importantly, AI that brings together data from multiple sources and essentially enriches it with consumer information, right? Things like demographics, behavioral data, etc. This allows customers, to better segment their customer populations in ways that basically leverages the demographic differences, the critical, clinical, behavioral, and preference differences. So we are now working on exposing this part of our capability, right? Essentially the data and the AI models behind those data sets as service to our customers so that customers can actually leverage them independently to enable, better interactivity in the different parts of the patient journey that goes beyond, the CRM, marketing automation, and content management capabilities that we provide. So this is there's a significant investment that we're putting into the space to essentially enable, data as a service and AI models as a service capability for our customers.
Well, that's awesome, and I can't wait to see and hear all about the growth of what's next at Mercury Healthcare. Thank you very much for jumping in and showing me all about how healthcare brands are building loyalty and the priorities there to build that consumer retention. Manish Goel, CTO at Mercury Healthcare, thank you very much for joining us, and definitely would love to have you back on the podcast at some point in the future.
Thank you.
Thanks for listening. Subscribe to Millennium Live to listen and learn on life and leadership.